The following presentation was completed on the evaluation of positive reinforcement and extinction procedures in decreasing inappropriate vocalizations in a classroom setting. The project was completed by Joanna Alexander, Andrea Chalmers, Melissa Macias, and Laura Rothamer. This project was completed through Southern Illinois University's Graduate Studies Program as part of Class 509A Behavior Analysis Research in the fall of 2015. Key words for our presentation include inappropriate vocalization, positive reinforcement, the procedures of extinction, the use of a withdrawal ABAB design, special education classroom, and individuals with severe cognitive impairment. One of the most common behavior problems in special education classrooms that teachers struggle with is inappropriate vocalizations. The reason these can be so frustrating to classroom teachers is because it can be difficult to determine the function of a behavior. A website, Educate Autism, reports 4 functions of a behavior, including social attention, tangibles or activities, escape or avoidance, or sensory stimulation. Once the function of the behavior is determined, it is much easier to begin writing a behavior plan. As there are many definitions that could explain inappropriate vocalizations, there are many behavior management procedures that could be potentially used to decrease this problem behavior. Kirk et al. 2010 uses class-wide group contingencies to decrease inappropriate vocalizations. Macias 2000 uses a self-management strategy with an individual participant. Another study by Balone et al. 2014 uses 2 separate interventions and compares them to see which is more effective at decreasing inappropriate vocalizations. One advantage to devising a behavior plan is there is no single intervention that works with every type of population. The reason this is an advantage is because if one intervention is not successful, there are still plenty of treatments to continue trying until one is found that is effective for a particular client or group of clients. One experimental design that is useful in determining the effectiveness of an intervention is a withdrawal ABAB design. Kasdan 2011 explains the ABAB design as it examines the effects of an intervention by alternating the baseline condition A phase with an intervention B phase. The AB phases are repeated again to complete 4 phases. While there are some disadvantages to using an ABAB design, there are advantages to implementing it as well. Cooper, Heron, and Heward 2007 explain the primary advantage of an ABAB design as its ability to provide a clear demonstration of the existence or absence of a functional relation between the independent and dependent variables. The purpose of the current study is to show that a combination of positive reinforcement and extinction procedures will be effective in decreasing the inappropriate vocalizations of 3 students. For our study, 3 students with severe cognitive impairments and/or multiple disabilities in a public junior high school were chosen. All students were in the same self-contained special education classroom. Each student had a history of loud and inappropriate vocalizations during group instruction. For our setting, all students sat in 4-legged desks or tables during group instruction. Groups were defined as 6 students with 1 to 3 teachers. Materials included laminated Velcroed positive behavior star charts with stars and digital pictures. For our project, we identified the dependent variable as a vocalization including a yelp, scream, cry, or wail, all heard at a volume at a minimum of 3 feet away or farther from the target student. Our data collection method included a partial interval recording method using 10-second intervals for a 10-minute session. Data was collected for 4 sessions per week during group academic or group functional instructions for a period of 4 weeks total. For inter-observer agreement, it was calculated at 38% for 6 out of 16 sessions. Mean scores of inter-observer agreement were at 95% in agreement. For procedural integrity, a checklist was used and calculated for 30% of all sessions, 5 out of 16 sessions. All 5 sessions received ratings of an average or excellent in all categories on the procedural integrity checklist. For social validity, a questionnaire based off of the guidelines by Fawcett 1991 was completed by all team members. The team felt that the experiment was valid to academic and functional improvement of target students, as well as improving social skills for all target students in the study. For our study, we utilized a withdrawal AB-AB design to evaluate the effects of positive reinforcement paired with extinction procedures to decrease inappropriate vocalizations during group time in a special education classroom. The experimental design uses a withdrawal phase to eliminate the effects of extraneous factors and prove that the intervention is what's impacting and affecting the behavior. Although we used a withdrawal AB-AB design, the team felt that the withdrawal phase and using the AB-AB design was still an ethical and appropriate choice for all target students of this study. For our procedures, we began with a preference assessment. We used a multiple stimulus without replacement method to identify tangible, non-edible preferred items. These included toys and books found in the special education classroom that the target students were familiar with. Baseline data was collected for 4 trials during a 1-week period during group, functional, or academic sessions while students were sitting at desks or tables. The intervention consisted of a positive behavior star chart, using continuous verbal praise for appropriate verbal behavior, either verbal or a use of a communication device, and a star on a star chart paired with a complete extinction or ignoring of all inappropriate target behavior. Once students received 5 stars on their star chart, immediately they were given 2 minutes of interaction with their preferred item and then returned back to group for continued instruction. The following slides will go over the results of our experiment. The results suggest that positive reinforcement paired with extinction procedures decreases the percentage of inappropriate vocalizations during group work instruction. This suggests that the intervention was effective and there was a functional relationship between positive reinforcement of appropriate vocalizations paired with extinction of inappropriate vocalizations as an intervention to decrease inappropriate vocalizations during group lessons in a special education classroom setting. Baseline data was collected over a week period during 4 separate sessions. During baseline, inappropriate vocalizations showed a stable trend. The average percent of intervals with vocalizations were 83%, 87%, and 93%. During our first phase of intervention, the average inappropriate vocalizations decreased to 55, 57, and 64 respectively percent. After returning to baseline and then to a second intervention, the average of inappropriate vocalizations returned to 46, 51, and 59%, showing a decrease in inappropriate vocalizations during the intervention phases each. During our study, the results showed that for all 3 students, when the treatment was withdrawn and gone back to baseline condition, there was a clear return to baseline levels, and then a clear improvement when returning to an intervention phase levels. The use of an AB-AB withdrawal design eliminated any effects of extraneous variables and proved that the intervention of positive reinforcement paired with extinction procedures decreased inappropriate vocalizations for students with significant cognitive impairment in a special education classroom setting during group instruction. The following results go over each student's individual results from the target intervention. Joy's baseline average was about 83.75%. Her intervention average of inappropriate vocalizations decreased to 53%. Ben's baseline average, he's the middle graph, started at 93% during baseline. During intervention phase, the average number of vocalizations decreased to 77%. George, our bottom graph, during baseline, averaged 87% of inappropriate vocalizations during intervals. During intervention phase, George's intervention averaged 52%. These results suggest that there are no other extraneous variables impacting the change in the behavior during the intervention phases. We were able to find that the use of both positive reinforcement and extinction was able to reduce inappropriate vocalizations in 3 participants. The intervention was effective in all 3 participants who all demonstrated a significant decrease in inappropriate vocalizations. Joy, Ben, and George all demonstrated lower inappropriate vocalizations during the intervention phase and increased inappropriate vocalizations during baselines. Previous research has been conducted to examine what types of interventions can be effective in reducing vocalizations that are not appropriate or interruptive. Response interruption and redirection has been deemed effective in reducing this type of problem behavior, as well as using a return to baseline design to reduce different types of problem behaviors. Our study took into consideration what other studies have analyzed and found an effective method to treat inappropriate vocalizations. There were a few limitations that may have affected our study. First, we used a partial interval scale because we thought it would be appropriate due to the frequency of inappropriate vocalizations within the participants. However, the scale does not record all behaviors that occur more than once during an interval. Therefore, we may not have an accurate representation of the frequency of inappropriate vocalizations. Another limitation to consider is that it was only conducted in one setting, groups. It may have been beneficial to analyze inappropriate vocalizations in multiple settings or activities to get a clear picture of how often or frequently the behavior was occurring outside of group activities. Threats to internal validity that we may not have taken into account are history and maturation. We did not take into account if any events were occurring outside the classroom that could have impacted the behavior of the participants. Lastly, there were no threats to construct validity found since the experimenters followed the procedural integrity checklist clearly and our intervention measured what it was intended to measure. Some considerations for future research to focus on are to examine similarities or differences of inappropriate vocalizations in multiple settings outside the classroom, such as lunch or gym. Also, generalizing positive reinforcement and extinction beyond the classroom could be observed to examine if the reduction of inappropriate vocalizations can be generalized and maintained over time. Another area of future research that could focus on is comparing positive reinforcement with another intervention, such as redirection or response interruption, to examine which is more effective in reducing inappropriate vocalizations. In addition, future research could also consider using a whole interval scale to have a better representation of the frequency of inappropriate vocalizations that occur. Lastly, another important area for future studies to examine is how the effects of others' inappropriate vocalizations influence the participants' behavior. Our study demonstrated the effectiveness of using a combination of positive reinforcement and extinction on reducing inappropriate vocalizations that occur during group work in the classroom. Much research has been conducted to target inappropriate vocalizations and finding an intervention that is effective in decreasing them. This area is socially significant for individuals who engage in inappropriate vocalizations in the classroom because they may serve as a distraction to the individual and a disruption to the class as a whole. The use of praise and reinforcement for appropriate vocalizations and extinction for inappropriate vocalizations can help an individual stay engaged in the classroom and promote positive interaction among students. This intervention can be applied outside the school setting, such as at home or in a community setting, in which inappropriate vocalizations may also occur. Positive reinforcement and extinction combined encourage individuals who engage in inappropriate vocalizations to use appropriate vocalizations that will help them decrease their inappropriate vocalizations overall. The following and last two slides of our presentation include the references used for the complete presentation. Thank you so much for watching our presentation on the evaluation of positive reinforcement and extinction procedures on reducing inappropriate vocalizations in the classroom. We hope that you got something out of it, and if you have any questions, please let us know. Thank you so much.